Hello, my dear students. In this class, let's review what you have learned. Follow me. Now, you have studied general principles, the first chapter, 4 chapters. You also studied drugs acting on afferent nervous system and the central nervous system, and you also studied diuretics. Followed me. Okay. The chapter 1, you mainly studied general introduction of pharmacology. In that chapter, you just know what means pharmacology, what pharmacokinetics and pharmacodynamics mean. In chapter 2, you mainly studied some terminologies and regularities about pharmacokinetics. Pharmacokinetics, it means what does the body act on the drug after administration. The drug enters the body, but they are exogenous substance. The body will mobilize many mechanisms to remove the drug out of the body. So the drug in the body, how much is the drug in the body after administration? The drug concentration in plasma will change with the time. So how about this change? A certain drug concentration in plasma determines a certain pharmacological effect. If you are a doctor, you want to get an ideal therapeutic effects. Only know how about the drug pharmacological effect. It is not enough. You also need to know well the drug pharmacokinetics. These chapters told you, first one, drug transmembrane transport. The characteristics of a drug in the body, usually we can use the 4 steps to describe. And every step, absorption, distribution, metabolism, and excretion, they all means the drug move in the body. Yeah, we also can consider this process of drug in the body as a tour of a drug in the body. The drug travel in the body. Yeah. Transmembrane transport affects every step of this process. And there are mainly 4 patterns of transmembrane transport, including filtration, simple diffusion, facilitated diffusion, and active transport. Do you still remember which pattern is the most common? Maybe you still remember? Yeah, simple diffusion. I mainly introduced the influential factors on the simple diffusion. There is an important phenomenon, air trapping. Do you remember this? This is the first terminology for you to study the pharmacology, actually. Air trapping. Once drug in some fluid, it must be dissociated. So the drug will exist in 2 forms, airnest and unairnest forms. But for the drug in the body, when they are in airnest form, because of higher polarity, they cannot pass across the cell membrane. This phenomenon is called by air trapping. Remember this? So based on this, actually, in some clinical practice, like we can alkalize the urine to promote some acidic drug excreted with the urine. Remember that? Yeah. And based on this principle, we also can analyze how about the drug distribution. If you know the drug, it is acidic drug or basic drug, you can analyze, you can guess how they distribute in the body. Yeah. And you also know how much is the pH value of the body fluid. Yeah. Absorption. Here, you mainly studied administration route. Different administration route, they have different velocity, different extent of absorption. And here you also study one important terminology: first pass elimination. This is very important. You should know well how to state. Yes, first understand. Distribution. Here you also study some influential factors, especially plasma protein binding rate. Because bound drug, after binding to the receptors, plasma proteins, the drug forms bound drug. They lose ability to pass across the cell membrane. So the drug, bound drug, just stay in blood vessels. So this will affect the drug, how they distribute inside blood vessels or outside of the blood vessels. Plasma protein binding rate, and this BBB means a blood-brain barrier. It also is a terminology. This has a protective significance for the brain tissue, seeing eyes. It is a real barrier for the drug. It's so difficult to pass across. So many drugs cannot affect the seeing eyes. You should also need to know how to state this terminology. Metabolism. The main organ for metabolism is liver, And here you mainly study hepatic drug enzyme. They can be inhibited or induced by some substance. Excretion. The main way is urine from the kidney, and the other, like skin or breast, also can excrete some drugs. So here you also studied one terminology: intrahepatic cycling, recycle. Yeah, this prolonged the half-life of the drug in the body. Yeah, for the biliary tract, maybe some drug also has therapeutic effect significance. Like some antibiotic drug has this intrahepatic cycling. It is very useful in the treatment of biliary tract infection. Yeah, in this chapter you study many parameters to describe how about the drug pharmacokinetics. Tmax, Cmax, half-life, clearance, VD, and bioavailability. AUC and CSIs. Yeah, use these parameters to describe CT curve, CT relationship, time concentration relationship. Yeah, especially half-life, clearance, bioavailability, VD, AUC, they are very important parameters to describe pharmacokinetics. Elimination kinetics of drug include two modes: first order and zero order kinetics. You should know well their concept, how to state, and how about their features. You should know well, especially first order kinetics, because it is the most common. In this chapter, pharmacodynamics, you also study many terminologies and also studied some regularity about pharmacodynamics. Yeah, there are so many terminologies, especially side effects, toxic effects, maximal effects, potency, ED50, ILD50, therapeutic index, safety margin, partial agonists, antagonists, they are more important. You should know well how to state. Yeah. Yes. Any one of terminologies you should know well, understand first, and then you can state with your own words. Yeah. On what the influence of competitive and non-competitive antagonists on the dose-response relationship curve of agonists? Do you still remember? Competitive antagonists make this curve shift right parallelly. But non-competitive antagonists just shift right down. Yeah. Competitive antagonists just increase the EC50 of the agonist. Decrease the potency of the agonist. It doesn't change Emax. But, non-competitive antagonist, maybe EC50 doesn't change, but Emax can be reduced. Emax of the agonist can be reduced by non-competitive antagonists. You should understand. In this chapter, you also mainly study these three concepts, especially dependence and tolerance. You must know well how to state. And I think this second question is much easier. Drugs act on the peripheral nervous system. You mainly studied cholinomimetics and anticholinergic drugs. Here, cholinomimetics include agonists, a direct agonist and indirect agonist. Indirect agonist means cholinesterase inhibitors. Yeah. Now, cholinomimetics here means direct agonist based on the selectivity to the different receptors include acetylcholine. It is non-selective cholinereceptor agonist. And receptor agonist, the representative drug here is pilocarpine. You must master its pharmacological effect and its clinical uses. You must master this. It's very important. Only 3 responses of the eye to pilocarpine. Do you still remember that? Yeah, include meiosis, decreased intraocular pressure, and cyclospasm, mainly used to treat glaucoma and iritis. You remember? No. N receptor nicotine. Yeah. Anticholinergic agents. It also subdivided into M receptor antagonist and N receptor antagonist, especially M receptor antagonist, atropine. It is the representative drug in this family. The pharmacological effects, mechanism of its action on the clinical uses, even adverse effects, contraindication. You should know well about this this atropine. And in M receptor antagonists, you also studied scopolamine, nisotamine, the others preparations. You just know their characteristics compared with atropine is enough. The N receptor actually succinylcholine or tubulin, they are skeletal muscle relaxant and two receptor blockers. They are relatively useful than this. So you just know what is the representative drug for depolarizing or non-depolarizing skeletal muscle relaxants is okay. Cholinesterase agents, inhibitors, reversible cholinesterase inhibitors like neostigmine, physostigmine, This drug, neostigmine, it is the representative drug in this group. You should know well it has the strongest effect on the skeletal muscle in the treatment of myasthenic rabies. It is the most commonly used. Based on the inhibition of cholinesterase, acetylcholine as a neurotransmitter, it cannot be inactivated. So there are it is similar to increased concentration of acetylcholine by these inhibitors. So they just increase the effect of M or N receptor, especially M receptors effect. And it also, because this neostigmine also can directly activate N2 receptor in the skeletal muscle. It also promotes the endogenous neurotransmitter release from the nerve terminal. So it has the strongest effect on the skeletal muscle. Irreversible cholinesterase inhibitors. They are organophosphorus compounds you have studied. For our human being, they are toxic. So the effect is just similar to acetylcholine. Once some patients has this organophosphorus compounds intoxication, how to save the patient's life? What are the specific antidotes to treat these conditions? You should know well. One is M receptor antagonist, another one is cholinesterase reactivators, PINE. Okay, receptor agonist and antagonist. Agonist or antagonist, their classification is also determined by the drug selectivity to the receptors. Non-selective. In this group include adrenaline, dopamine, and ephedrine. This is not adrenaline and ipamorelin. Isoprenaline, dalbutamine, and salbutamol. This is selective beta-2. Dalbutamine is selective beta-1 receptor agonist. Salbutamol is a selective beta-2 receptor agonist. This isoprenaline, another name, it is a non-selective beta receptor agonist. And these three agents in red color, they are more important than the other preparations. Especially adrenaline is a pharmacological effect on the clinical uses. You must know well. And now adrenaline, this drug mainly activate alpha receptor, especially alpha 1. And it also has a little activation on beta 1 receptor. So increased blood pressure is so obvious. But it just increased the peripheral resistance. Also, if it used for relatively longer time, it may induce ischemia. You should know well their clinical uses. Antagonists alpha antagonist, phentolamine and pyridoxine. This is a selective alpha-1 blockers. Propranolol, timolol, motolol, isomolol. Yeah, this beta receptor antagonist. Labetalol is mixed antagonist. You should also need to know well their clinical uses. And I think if you know well the alpha or beta receptor, where they locate, and how about their activation function, their function of their activation. What are the function of this alpha or beta receptor function? I think their pharmacological effects are very easy to understand, and based on the pharmacological effects, you can guess what are their clinical uses. For example, phentolamine. Do you still remember this? Yeah, because of blockade of alpha-1, it induces vasodilation. But act on the heart, it because of body reflex and alpha-2 blockade, it can increase the heart rate. So it cannot be used to treat hypertension, but pyridoxine can be used to treat hypertension. Phentolamine, it can be used to treat renal phenomenon, peripheral occlusive, like renal phenomenon. It can be used to treat, and it also used to treat some like noradrenaline induced ischemia. Yeah. And it also used to diagnose or prevent acute crisis or operative management of pheochromocytoma. Yeah, and it also used to treat like cardiac, heart failure, shock. Yeah, it also is useful. Do you also remember? Propranolol, because it can block beta-1 and beta-2. So this drug mainly is for some cardiovascular system disease like hypertension, endophthalmitis, and acute myocardial infarction, and tachyarrhythmias, and it also used to treat migraine. Yeah, actually, some mild chronic congestive heart failure, it also is useful. Yeah, you will study it. Local anesthesia, uncommon used drug. Yeah, in this chapter, you studied local anesthetics. Yeah, you also study how to use them. It includes several different local anesthesia type: surface, infiltration, conduction, subarachnoidal, and epidural anesthesia. Don't forget regional analgesia. Yeah. In this chapter, actually, no one agent can be considered as the representative drug. They have different characteristics. They are used for different type of local anesthesia. Tetracaine, because of the highest penetration, it is the most common used for surface anesthesia, but because it has a relatively higher toxication, it is too toxic. So for the infiltration, it is not used. But many other agents can be used for infiltration anesthesia. Procaine, lidocaine, and procaine, it also used to treat ventricular arrhythmias. Lidocaine also used to treat ventricular arrhythmias. Bupivacaine, similar to lidocaine, but has a stronger anesthesia, but it also has a cardiac intoxication. The ropivacaine, it has a relatively less effect on the somatic nerve. So for the regional analgesia, it is the most commonly used. And the procaine also has allergic reaction. Yeah, in fact, the drugs on the seeing eyes you have studied sedatives and hypnotics, anti-epilepticus, anti-Parkinsonian drugs for psychiatric disorders, and opioid analgesics. Actually, opioid analgesics, most of them, they are mainly used to relieve pain. To relieve pain, you also studied NSAIDs. Now, sedative hypnotics. In this chapter, you mainly study benzodiazepines. Diazepam is the typical drug of benzodiazepines. What are the pharmacological effects and the therapeutic applications of benzodiazepines? You should know well. Do you still remember? The first one is reduction of anxiety. Used to treat anxiety. And the second is sedation and hypnosis. So used to treat different type of sleep disorders. Only with the dose increase, benzodiazepine also has anti-epileptic effect and anti-seizure effect, used to treat some seizures attack, include seizures epilepticus and eclampsia. Benzodiazepines also induce amnesia. If used for some unhappy cure, it is helpful. And with the dose further increase, it also used to relax the skeletal muscle spasm caused by some central neuron. In this chapter, you also studied barbiturates and other agents. But barbiturates compared with benzodiazepines, they have no effect to reduce anxiety, and they also can cause anesthesia. Once we administered dose large enough, induce anesthesia. But benzodiazepines cannot induce anesthesia. These are their difference. And they also have different mechanism. Benzodiazepines, because it can bind to the GABA receptor and then increase the frequency of the chloride canal opening. So increase the chloride ions influx. But barbiturates just prolong that opening of chloride channel, prolong that duration. The result all increase the inhibitory effect on the seeing eyes, but they have different mechanism. Anti-epileptic drugs. In this chapter, you also studied many anti-epileptic drugs, many agents, and similar to local anesthetics, no one can be considered as the representative drug. And you should know well which drug used for which type of anesthesia type, used for any type of seizure attack. Understand? For example, the diazepam, it is the first choice in the treatment of status epilepticus. Isosaximide. Do you remember which type of seizure it is the first choice? Yeah, absence seizure. Sodium phentoin for partial anesthesia and tonic-clonic anesthesia, it is the first choice. For the grand mal mixed grand mal and petit mal sodium valproate, it is the first choice. Okay? Drugs for psychiatric disorders. In this chapter, you studied antipsychotic drugs, anti-manic drugs, and antidepressant drugs. Yeah, antipsychotic drugs are more important. Lithium salt, it is representative drug of anti-manic drug. Imipramine, it is representative drug of antidepressant agents. It's okay. On the antipsychotic drug, you mainly study clompromazine. This drug is more important than others. You should know well their pharmacological effect, therapeutic applications, even adverse effects. You must master them very well. Okay? If you forget, try to review in time. Anti-Parkinsonian drugs. Based on the mechanism of Parkinson's disease, because of imbalance between the dopaminergic pathway and cholinergic pathway, because of that imbalance, we try to recover that imbalance depending on these agents to increase the dopaminergic pathway function. But these agents, dopaminergic agents like levodopa and carbidopa, and some receptors agonists, these two enzymes inhibitors, especially these two preparations are more important. Levodopa, for the patients with Parkinsonian, levodopa, the dopamine as a neurotransmitter in CNS is not enough. We should supply enough dopamine for the body, for the CNS brain tissue. But dopamine cannot pass across BBB, so we just use precursor of dopamine, levodopa. But levodopa also convert into dopamine in the peripheral tissue, induce many adverse effects in the peripheral tissue. So it is necessary to use carbidopa in combination with levodopa. Do you also still remember this? Why they used in combination? And is this drug just to improve the symptoms of the patients with Parkinsonian? Because this is degenerative disease. With the drug therapy, finally, they often induce many adverse effects, even lose their therapeutic effects. So what are the adverse effects of them? Levodopa. Try to think of. If you forget, review. To recover this imbalance, we also can use anticholinergic agents to decrease the function of cholinergic pathway. But it is not atropine. Here, it is trihexyphenidyl. mainly act on the seeing eyes, of course. It also can act on the peripheral tissue, induce some other effects similar to atropine. Opioid analgesics. It also based on the different activation of opioid receptors. They include different groups. Especially in this chapter, you mainly study morphine, especially the pharmacological effects and therapeutic applications of morphine. You must master well, and even its adverse effects, you also should know well. The pharmacological effects of morphine include effects on seeing eyes and peripheral tissue. In the peripheral tissue, it mainly include effects on the smooth muscle and the CV eyes. Pethidine, it is a secondary important drug in this chapter. And fentanyl, in this chapter you also studied opioid receptor antagonist. You must know well this naloxone. Okay, what are the pharmacological effects of and their clinical uses? If you forget, try to review in time. Okay. About non-steroidal anti-inflammatory drugs, it also based on the selectivity to the receptor to the COX, include non-selective COX inhibitor and selective COX-2 inhibitors. And in this chapter, I think you still remember aspirin. It is the most important agent. Yeah, it is the representative drug in this chapter. You must master well their pharmacological effects and their action mechanism. Inhibition of COX to inhibit the prostaglandin synthesis. This is their shared mechanism of action. They also share some pharmacological effect, like anti-inflammatory effect and antipyretic effect and anesthetic, analgesic effect, and like aspirin also has antiplatelet effect, antithrombotic effects, and especially aspirin, you must master its pharmacological effects and clinical uses, even adverse effects. You must master well. In this chapter, you also should know this acetaminophen, because in our daily life, this drug is so common used. It's so common used. Especially for children, it is safer than atropine. To relieve fever of children, it is common used. Diuretics. This chapter, you also studied many drugs, including high-saline diuretics, SERDAS, and potassium-sparing diuretics, and carbonic anhydrase inhibitors. These drugs, these two groups, because they are relatively more common used, like high-saline diuretics, furosemide, it is the representative drugs in this family. It has very potent, very transient, but powerful diuretic effects. So they are usually used for some emergency, like acute pulmonary edema. You know, it is the first choice to promote some toxicants excretion. It also used to use this drug. On the third, that because their diuretic effects is relatively mild and lasting, so for some chronic disease, they are so common used, like hypertension, yeah, and some chronic edema, even nephronic pituitary diabetes. This drug also is useful because it can decrease the calcium excretion. So for the treatment of hyperuricemia, it also use this cell to treat. Yeah, because they are relatively commonly used, so their adverse effects you must master well. These two groups, adverse effects, you must master well. And on this slide, I think you know their classification and their target action, their target of their action, mechanism of their diuretic effects. Yeah, you can know well this. Okay, that's all.